the ways of infection, experts make a huge discovery in the coronavirus strain in the country. One infectious disease specialist says the virus causing the disease may have originated from India instead of China, ground zero of the pandemic. Let's find out more from the man behind this study, Dr. EDSEL SALVANA. Doctor, thank you so much for joining us. Any significance if the coronavirus originated either from India or China?
Good evening, Rico. Good evening to everyone. Yeah, I think, and again, we have had 10,000 cases in the Philippines, and the sequences that we have are really just 12 whole genome sequences that were done sometime in March. So yung first introduction, I won't call it a wave, but the first 3 cases that we had were all Chinese cases. Right. Unfortunately, we weren't able to sequence those, but because those 3 came from Wuhan, most likely those viruses would have originated from China. However, when they sequenced this local transmission, about 12 of them, if you look at something called next strain, which actually gets all the sequences in the world and analyzes them, parang, parang family tree, it turns out that the most related virus that of those 12 in the Philippines, the most common ancestor niya actually came by way of India, which came to India from Australia and came to Australia from China. So umikot muna siya. And so in a way, there was a second introduction that became the first local wave. Whatever you want to call it, but the local transmission in March seemed to have at least partially originated from India.
So, Doctor, would we know if the originator from India was an Indian national, a Filipino, or a foreigner?
Yeah, it's impossible to know that because all we have is the genetic material of the virus. And so anybody, because there's no immunity yet to the virus, anybody could have brought it in, whether it was a Filipino who came from India, a tourist who came from India, or an Indian national. We don't have that data, but we do know that the virus that circulated in the Philippines, at least 12 of them, are highly related to viruses that are now circulating in India.
What is your view right now of all these number of infections in the country, the number of people who have recovered, and the people who have passed away? Where are we right now in this whole testing, tracing, and treating this COVID-19 in the Philippines?
I think if you do comparisons across the world, and we know in America there's 1.5 million cases already, 90,000 plus deaths already. Compared to that, we're doing actually pretty well. Of course, compared to Vietnam and Thailand, not so well. But the level, if you look at the number of cases and the number of tests we've done, which is about 250,000, our closest match, surprisingly enough, is Japan. And Japan's a first world country. So basically, our ECQ seems to have really controlled the number of cases. Because whether or not you're doing enough testing, if you're not flattening your curve, your health system will be overwhelmed. The whole point of flattening the curve is to give your health system time to catch up para hindi ka mag-surge above it and people will die. So in that sense, we flattened the curve because our healthcare system did not get overwhelmed, although it was close at the start.
All right. We want now some clarification, Doctor, because there's a lot of questions about for asymptomatic cases positive for COVID-19. Can they or can't they not transmit the virus?
Yeah, so this is yet another term that's kind of like the wave, it's a confusing term. Okay, so asymptomatics are divided into real asymptomatics. Ibig sabihin, they get the disease, they never have symptoms, and then they recover. As you can imagine, those are really hard to find because they don't have any symptoms. And to prove that their virus transferred to somebody else is near impossible because you can't isolate their virus because you can't find them. The only way you find out that these people recovered is they will have antibodies to the virus. But you never know when they actually got the disease. Now, meron yung tinatawag na pre-symptomatic. And what does this mean? This is somebody who is going to get sick Pero 2 to 3 days before they actually have symptoms, they're already shedding the virus. Although not very efficiently because they're not coughing, they're not sneezing. We know naman that respiratory droplet is the main way that this
That's right,
gets
doctor.
spread.
Yes.
Right. So we know that among symptomatics are responsible for about 85% of the transmission, whereas itong pre-symptomatic transmission is only about 12.6%. Yung true asymptomatic, maybe it occurs, but we don't have definitive proof that it does.
And briefly, doctor, before we let you go, what about these rapid antibody tests? There's a lot of discussion as well if we can find out if this is an effective method in finding out if indeed a person is COVID-free.
Well, the problem with antibody tests is it doesn't detect active infection. It takes about 7 days from the time that you have symptoms before the antibody test will become positive. Kasi antibody nga siya, your body has to make it. By then, you're actually, at least the mild cases, they're getting better. You're not shedding much virus. Past ka na dun sa peak na nagsished ka talaga ng maraming virus. So it will miss it. You know, when the person is most infectious, when they're only starting to have symptoms, all the way to the 5th day of symptoms, negative yung antibody test mo because the antibody test only becomes positive towards the end of the disease. So what you really want in symptomatics is a PCR. And the PCR can detect pre-symptomatics 2 to 3 days before they have symptoms. But earlier than that, it will still be negative. So the point is, there's really no good test to rule out asymptomatics. The best way to do that is to really kind of COVID-proof your environment, you know, wear masks and everything. Para with symptoms, you can control 85% of the transmission. As for the asymptomatics or pre-symptomatics na wala kang good test, then at least you prevent them from transmitting.
We cannot let our guard down. Just keep on wearing those masks and wash our hands several times a day. Thank you so much for joining us, Dr. EDSEL Salvana, an infectious disease specialist. And we'll take the short break.